Welcome, Laney Dihn. Thank you so much for joining me. I wonder if you could tell the audience a little bit about who you are so they know who they're chatting with.
Thank you for having me, Michelle. My name is Laney Dihn. I am a registered nurse based out of Portland, Oregon. I work with oncology, which means I work in oncology, which is with cancer patients.
Okay, thank you. And the coronavirus has thrown us all for a loop. Can you tell me about some of the structural changes that you are seeing at the hospital, any of the changes that they've made as a result of coronavirus, and any you think might continue past the coronavirus?
When the first coronavirus positive patient was started here in Portland, Oregon, it happened at a Kaiser facility or a Kaiser patient member. And that was probably about sometime in March, beginning of March or end of February, somewhere within that time frame. There has been a lot of policy changes within the hospitals, grocery stores even, out in public. There's a lot of stay-at-home orders. So within the hospital, a lot of people management has decided that many places have patients and staff members wear masks when coming for care. They are not allowing any visitors at this point in time to accompany patients who are coming for care. Currently, patients are they can wear their own masks, and if they do not have their own mask, one will be provided to them. And there used to be places where in the hospitals, where in the lounge area, they would offer coffee or snacks like cookies or crackers or juice. That is no longer being provided at this time until further notice. Trying to think of what else is different.
So talk to me about a protective gear. A lot of information about there, what is available, what isn't available. As a nurse on the floor, what are you seeing?
For protective gear, in my setting, I work with immunocompromised patients who don't have the greatest immune system or the strongest immune system because they're undergoing chemotherapy. And all the staff members are wearing masks the whole time they're caring for patients. However, we are not being provided any I don't feel that we are being provided adequate amount of PPE, personal protective equipment, and that would include an N95 respirator mask, a gown, and a face shield. We are conserving our supplies at this point in time. So instead of we normally in the past would switch out masks in between patients or gowns in between patients, but we are being asked to forego our gowns at this point in time or to conserve our supplies. Or if we do choose to wear a gown when handling the chemotherapy, that's okay too. So we're being given the option for that. And I don't think that's safe because it goes against our normal practice, our standards.
I agree.
And being that we work with immunocompromised patients, it's difficult because we could be asymptomatic with the virus, having the virus and showing no symptoms, and potentially pass it along to our patients and not even know it.
I agree. It's interesting why the hospital would feel that that would be a change with a population that is high at the risk. I understand the need to conserve, but obviously it sounds like the personal protection equipment is not sufficient for you guys, and that is why you're having to make some of these compromises.
Yes.
What about in terms of, we are told that if we come down with a fever or not feeling well, we should self-isolate for 14 days. What's happening with the nursing community and the doctors there?
Because this is an evolving situation, they keep changing the criteria for that. For example, they're telling patients that to quarantine for 14 days should they be, again, showing symptoms, especially if they've gotten tested and they're positive. However, among staff member, staff members, they told us from the infectious diseases compartment or department of the facility, they're telling us that if you're showing symptoms or you've been tested positive, you need to remain asymptomatic, having no symptoms, for at least a week. Then they recently changed that to 3 days. Mm. And I'm sure that coworkers, if I were to test positive and then I didn't show any symptoms for 3 days and then I returned to work, I feel that my coworkers, my colleagues would be very uncomfortable working side by side with me.
As would, I would imagine, your patients.
Yes.
You know, last time we spoke, you were giving me some really interesting information about some of our brave Navy and what's going on the ships. And we were talking about the Theodore Roosevelt ship, I believe. Could you talk a little bit more, tell us what your understanding is of the situation, because you have some friends that you know on the ship?
Yes. So the USS Theodore Roosevelt is an aircraft carrier. An aircraft carrier on deployment can have a crew of approximately 4,000 to 5,000 personnel. They had stopped in Vietnam at the beginning of March for a port visit. At that point in time, I believe it's just over a dozen positive cases for COVID. And so at that point in time, the US, the world, didn't deem it as something that was worrisome or crucial at that time. So they pulled into port. And so when you pull into port, the sailors will go out and about, do whatever they want to do for some rest and relaxation. And when they got back on the ship, within a few weeks, there were people starting to come down with the virus. And the captain, I believe his name is Captain Crozier is the last name, he had sent out an email or a letter voicing his concerns about how, and questioning, like, are we going to remain, are we going to be able to maintain our operational readiness? Are we going to be able to carry out the missions that we had planned? Because if the virus runs rampant on the ship, which it can because we're in close quarters, more and more sailors can get sick. So this letter, from what I understand, he had attempted to reach out to his upper chain of command to no avail. They kind of just shrugged their shoulders and just said, carry on. And so when this one particular letter got leaked, it made it to the news source, to the media, and the Secretary of the Navy fired this captain. He flew all the way to Guam, where the ship is currently at, made a speech to the crew members, called the captain stupid within his speech, and he dismissed the captain. Come to find out, after his dismissal, the captain is now positive for COVID.
Oh no.
We have, last I read, over 500 cases of COVID on the ship.
How many Navy, how much staff on the ship?
4,000 to 5,000.
Oh my goodness. So
That's
with
a lot.
4,500, you're talking about 10% are testing positive for COVID.
Mm-hmm. And they do have the crew members in quarantine. However, last I heard, despite having them in hotel rooms, isolated from one another, more and more sailors are still coming down with it. I know 2 people who are on that ship personally, and one of them has recently come down with COVID. Despite
when you say recently, so even though the ship, people started showing signs earlier on, it sounds like people are still showing up as being affected well after the date we would have expected.
Yes.
So not within like a 14 days. Well, if you're exposed to them within 14 days, otherwise you're safe. It doesn't sound like that's what's going on.
I don't think so.
Oh,
and
goodness.
I don't think that's, I think that's the case. I don't know if they're taking all the precautions necessary, or so, they say. There has also been now a sailor who has passed away from
oh my God.
on that ship.
Wow, that is just, oh, and my hearts go out to those people. Well, Laney, I want to thank you for the time. This was really wonderful. I really appreciate it. I want you to stay safe, healthy out there, keep your loved ones' health, and I wish you all the best. Stay in touch.
Thank you for having me.
Thanks.